My name is Madison Rios, and I will be doing a presentation on syphilis. How long have sexually transmitted infections, or STIs like syphilis, been around? Syphilis is an ulcerative sexually transmitted infection which has been affecting people since 3000 BC. Unfortunately, syphilis can cause many health issues and possibly death if untreated. The spiral-shaped bacterium Treponema pallidum is responsible for the spread of syphilis and must be in the body to survive. Even today, thousands of people have contracted syphilis due to many factors like change of culture, generation, and morals. The dangers of syphilis have greatly been undermined for hundreds of years, which is why proper understanding of the STI is essential in prevention, transmission, and treatment. I will explain the importance of understanding the risks of syphilis to inform the public to take precautionary measures in everyday life. Syphilis is often not discussed in terms of symptoms and the phases that take place along with this infection. Syphilis is an ulcerative STI that causes chancres, which often affect the area like vagina, anus, rectum, lips, and mouth. According to the Mayo Clinic, symptoms often vary between chancres, syphilic dermatitis, which are red and brown rashes, fever, sore throat, and weight loss. Bacterium Treponema pallidum causes syphilis and requires a warm and moist environment to excel in mucous membranes. This spirochete reaches lymph nodes, then the rest of the body. There are 4 stages of syphilis that categorize the growth of the STI, which occur from beginning of infection to 20 to 30 years after. Reports by the National Library of Allergies and Infectious Disease, syphilis can be categorized by 4 stages of primary, secondary, latent, and tertiary stage. Primary stage is categorized by painless chancres around or on the site of infection. Secondary stage often consists of a brown or red rash and occurs 2 to 8 weeks after exposure. Some organs may begin to show signs of inflammation and infection. Latent stage is a period in which subjects will still be contagious, experience no symptoms. However, the disease still spreads throughout the body. Tertiary stage is often most severe and occurs around 20 years after infection. Gummus, a growth that begins to form causing inflammation to the internal organs. Mental disorders such as neurophilis, cardiovascular syphilis, and death occur. Syphilis, one of the most severe sexually transmitted diseases, may result in death, which is why people should be more cautious, especially due to its highly infectious qualities. Okay. How is syphilis transmitted? Syphilis has survived thousands of years due to its method of transmission. From seniors to newborns, syphilis can infect and live in the body for a long time. Everyone is at risk. Syphilis is transmitted in many ways, for example, oral, anal, and vaginal intercourse. In fact, the Texas Tribune supports my reasons for concern by stating that each year 26,000 people come in contact with this disease each year in Texas alone. There are many misconceptions regarding who can get syphilis, but the short answer is everyone can. Due to syphilis, the method of transmission is important, and one should voice the concerns to a doctor to treat and aid prevention of further transmission. I will explain how to treat syphilis and what to do if you have it. Ask your doctor, get tested, inform previous partners, and start treatment. Patients are often given penicillin. Nevertheless, treatment is important in treating syphilis, as it may be dangerous and life-threatening sexually transmitted infection. Syphilis transmission has skyrocketed since 2015 due to the lack of public understanding as a result. Over 200,000 people today are infected. By gathering a proper understanding of anatomical and physiological dangers of syphilis and its transmission, one can be more cautious by taking precautionary measures. An infection like syphilis has lasted thousands of years because of its transmittable properties. Let's try and eradicate or slow down the spread of this disease by practicing precaution and making smart decisions.